First of all, it's a great honor, and to me, it means that something that I've devoted my entire life to, that I think I do well, is being recognized by others as being an important contribution on my part. Well, I've always sort of sought the toughest challenge in my life, and when I was training during my residency program, the head and neck cancer patients seemed to be the sickest on the service. Head and neck cancers really are a horrendous disease. It robs you not just of your life, but before it robs you of your personality. It involves areas. It changes your appearance. It changes your ability to swallow, to speak. Sometimes the inability to breathe. So they seem to be the most in need of help, and so I just gravitated towards treating those people, and did extra training in head and neck surgery, and eventually focused my career entirely on helping head and neck cancer patients. Medicine in general is rewarding. Because I don't think there's any more worthwhile way to spend your life than helping people and treating disease, making them feel better. I don't know obviously lots of professions are important, but to me, I don't know how you can go wrong devoting your life in the practice of medicine. Well, I think the most significant part is not so much the awardees like me or the awards that are given, but it's the scholarships, as you say. It's a mechanism by which we can generate resources to give people scholarships so that they can pursue their dreams, and of going into medicine, hopefully, and devoting their life in the practice of medicine. I think that's the important thing, is not so much the awardees, but the purpose of the whole event, which is to raise scholarships for young people. They're the future of medicine. My commitment to it is enormous. I think it's a very important part of my professional life, and one that gives me great joy and reward. It's really, really heartening for me when I see a medical student come in their second, third, or year, and they say they want to go into my specialty, and they're starry-eyed and they really want to. They really don't know what they're getting themselves into sometimes. But when I have the opportunity to mentor them and sometimes train them directly and watch them mature and develop their skills over the next 5 to 7 years, and then think back on what they were like when they first walked into my office, and how since I'm sort of the chairman of the department, I give them their degrees at the end, and to realize that here's an individual that 7 years ago knew very little about the specialty, and now they are trained to the point where I would feel comfortable being their patient, having them operate on me, having them operate on one of my family members. It's a great thrill to see somebody mature that way.